Stop scrolling. If you're preparing for the Nclex RN, this video is non-negotiable. Today, we're breaking down 50 pediatric Nclex questions you must pass. The kind of questions that test airway, growth and development, emergencies, and priorities exactly the way the real Nclex does. No beginner stuff, no guessing games. Every question is clinically accurate, exam style, and high yield. So, grab a notebook, lock in, and don't blink. Because by the end of this video, you'll be thinking like an Nclex-ready nurse. Let's get into it. Question 1. A nurse is caring for an infant with bronchiolitis. Which finding requires immediate intervention? A. Respiratory rate of 48 per minute. B. Nasal flaring and retractions. C. Poor feeding. D. Wheezing on auscultation. Answer B. Nasal flaring and retractions. Nasal flaring and retractions indicate increased work of breathing and potential respiratory failure. This is the priority. Question 2. Which toy is most appropriate for a 2-year-old hospitalized child? A. Board game. B. Coloring book. C. Push-pull toy. D. Video game. Answer C. Push-pull toy. Rationale: toddlers benefit from gross motor and movement-based toys that support autonomy and exploration. Question 3. A child with suspected epiglottitis is admitted. What is the priority nursing action? A. Obtain a throat culture. B. Inspect the throat with a tongue blade. C. Prepare for possible airway obstruction. D. Encourage oral fluids. Answer C. Prepare for possible airway obstruction. Rationale: epiglottitis can cause sudden airway obstruction. Airway management takes priority. Never visualize the throat. Question 4. Which finding is expected in a child with dehydration? A. Bounding pulses. B. Sunken anterior fontanelle. C. Bradycardia. D. Hypertension. Answer B. Sunken anterior fontanelle. Rationale: a sunken fontanelle is a classic sign of dehydration in infants. Question 5. A nurse is teaching parents about preventing lead poisoning. Which instruction is most important? A. Avoid dairy products. B. Wash hands before meals. C. Limit outdoor play. D. Increase vitamin D intake. Answer B. Wash hands before meals. Rationale: hand-to-mouth activity is common in children. Hand washing reduces lead ingestion. Question 6. Which intervention is appropriate for a child experiencing a febrile seizure? A. Place the child in a prone position. B. Restrain the child. C. Administer antipyretics after seizure stops. D. Insert an oral airway. Answer C. Administer antipyretics after seizure stops. Rationale: febrile seizures are usually benign. Lowering fever after the seizure helps prevent recurrence. Question 7. A nurse is caring for a child with sickle cell disease. Which finding indicates a vaso-occlusive crisis? A. Joint and abdominal pain. B. Increased hemoglobin. C. Bradycardia. D. Cold intolerance. Answer A. Joint and abdominal pain. Rationale: vaso-occlusive crises cause ischemic pain, commonly in joints and abdomen. Question 8. Which immunization is contraindicated in a child receiving chemotherapy? A. Inactivated influenza. B. Hepatitis B. C. MMR. D. DTaP. Answer C. MMR. Rationale: live vaccines, MMR, are contraindicated in immunocompromised children. Question 9. A parent reports their infant has projectile vomiting after feedings. Which condition does the nurse suspect? A. Gastroesophageal reflux. B. Intussusception. C. Pyloric stenosis. D. Hirschsprung disease. Answer C. Pyloric stenosis. Rationale: Projectile non-bilious vomiting in infants is classic for pyloric stenosis. Question 10. Which assessment finding is normal for a newborn? A. Absence of Moro reflex. B. Irregular respirations. C. Posterior fontanelle open until 1 year. D. Blood pressure higher than adults. Answer. B. Irregular respirations. Rationale. Newborns normally have irregular breathing patterns. Other options are abnormal. Question 11. A nurse is caring for a child with croup. Which finding requires immediate action? A. Barking cough. B. Hoarseness. C. Inspiratory stridor at rest. D. Low-grade fever. Answer. C. Inspiratory stridor at rest. Rationale. Stridor at rest indicates severe airway obstruction and impending respiratory distress. Question 12. Which assessment finding is expected in a child with iron deficiency anemia? A. Jaundice. B. Pallor and fatigue. C. Elevated bilirubin. D. Petechiae. Answer. B. Pallor and fatigue. Rationale. Iron deficiency causes decreased oxygen delivery, leading to pallor and fatigue. Question 13. A nurse is caring for a child after a tonsillectomy. Which finding indicates post-operative hemorrhage? A. Refusal to drink. B. Frequent swallowing. C. Sore throat. D. Low-grade fever. Answer. B. Frequent swallowing. Rationale. Frequent swallowing suggests bleeding. Blood may not be visible. Question 14. Which assessment finding is most concerning in a child with asthma? A. Expiratory wheezing. B. Prolonged expiration. C. Silent chest. D. Use of accessory muscles. Answer. C. Silent chest. Rationale. A silent chest indicates minimal air movement, a life-threatening sign. Question 15. A child is diagnosed with intussusception. Which symptom is expected? A. Projectile vomiting. B. Current jelly stools. C. Clay-colored stools. D. Chronic diarrhea. Answer. B. Current jelly stools. Rationale. Blood and mucus stools, current jelly, are classic for intussusception. Question 16. Which food should be encouraged for a toddler with constipation? A. Cheese. B. White rice. C. Applesauce. D. Whole grains. Answer. D. Whole grains. Rationale. Fiber-rich foods promote bowel motility. Question 17. A nurse is caring for a child with nephrotic syndrome. Which finding is expected? A. Weight loss. B. Decreased urine protein. C. Periorbital edema. D. Hypertension crisis. Answer. C. Periorbital edema. Rationale. Protein loss causes fluid shift, leading to edema, especially around eyes. Question 18. Which intervention is appropriate for a child with acute otitis media? A. Insert eardrops forcefully. B. Encourage supine position. C. Administer prescribed antibiotics. D. Clean ear canal daily. Answer. C. Administer prescribed antibiotics. Rationale. Bacterial otitis media requires antibiotic therapy. Question 19. A nurse is teaching parents about sudden infant death syndrome, SIDS. Which instruction is correct? A. Place infant prone. B. Use soft bedding. C. Share bed with parents. D. Place infant on back. Answer. D. place infant on back. Rationale: back sleeping significantly reduces SIDS risk. Question 20. Which assessment finding suggests developmental delay in a 9-month-old? A. Stranger anxiety. B. Sitting without support. C. Inability to roll over. D. Pincer grasp emerging. Answer: C. Inability to roll over. Rationale: rolling over should occur by 4 to 6 months. Question 21. Which finding is expected in a child with type 1 diabetes mellitus? A. Weight gain. B. Polyuria and polydipsia. C. Bradycardia. D. Hypertension. Answer: B. Polyuria and polydipsia. Rationale: hyperglycemia causes osmotic diuresis, leading to excessive thirst and urination. Question 22. A nurse is caring for a child with suspected appendicitis. Which assessment is priority? A. Rebound tenderness. B. Pain migration to RLQ. C. Nausea. D. Loss of appetite. Answer: B. Pain migration to RLQ. Rationale: classic pain migration strongly supports appendicitis diagnosis. Question 23. Which play activity is best for a school-aged child? A. Parallel play. B. Solitary play. C. Cooperative games. D. Sensory toys. Answer: C. Cooperative games. Rationale: school-aged children enjoy rules and teamwork. Question 24. Which assessment finding indicates dehydration in a toddler? A. Moist mucous membranes. B. Tear production. C. Delayed capillary refill. D. Increased urine output. Answer: C. Delayed capillary refill. Rationale: poor perfusion causes delayed cap refill. Question 25. A nurse is caring for a child with meningitis. Which isolation is required? A. Contact. B. Airborne. C. Droplet. D. Protective. Answer: C. Droplet. Rationale: bacterial meningitis spreads via respiratory droplets. Question 26. Which finding is expected in a newborn of a diabetic mother? A. Hyperglycemia. B. Hypoglycemia. C. Low birth weight. D. Hypothermia. Answer: B. Hypoglycemia. Rationale: excess maternal glucose, fetal insulin, post-birth hypoglycemia. Question 27. Which sign indicates increased intracranial pressure in an infant? A. Sunken fontanelle. B. Bulging fontanelle. C. Bradycardia only. D. Decreased head circumference. Answer: B. Bulging fontanelle. Rationale: bulging fontanelle reflects increased ICP. Question 28. A nurse is caring for a child with cystic fibrosis. Which intervention is priority? A. Limit fluids. B. Chest physiotherapy. C. Low protein diet. D. Restrict activity. Answer: B. Chest physiotherapy. Rationale: chest physiotherapy helps mobilize thick secretions. Question 29. Which lab finding is expected in a child with dehydration? A. Low hematocrit. B. Decreased sodium. C. Elevated hematocrit. D. Low BUN. Answer: C. Elevated hematocrit. Rationale: fluid loss causes hemoconcentration. Question 30. Which sign indicates hypoxia in an infant? A. Crying. B. Acrocyanosis. C. Nasal flaring. D. Pink mucosa. Answer: C. Nasal flaring. Rationale: nasal flaring reflects increased oxygen demand. Question 31. A nurse is caring for a child with gastroenteritis. Which assessment is most important? A. Lung sounds. B. Fluid intake and output. C. Bowel sounds. D. Skin integrity. Answer: B. Fluid intake and output. Rationale: risk for dehydration is the priority. Question 32. Which condition is associated with a machine-like murmur? A. ASD. B. VSD. C. Patent ductus arteriosus. D. Tetralogy of Fallot. Answer: C. Patent ductus arteriosus. Rationale: PDA produces a continuous machine-like murmur. Question 33. Which intervention is appropriate for a child with epistaxis? A. Tilt head back. B. Apply pressure to nose. C. Pack nose immediately. D. Apply heat. Answer: B. Apply pressure to nose. Rationale: firm pressure controls anterior nosebleeds. Question 34. A nurse is caring for a child with burns. Which finding suggests hypovolemic shock? A. Bounding pulse. B. Decreased urine output. C. Hypertension. D. Warm skin. Answer: B. Decreased urine output. Rationale: low urine output reflects poor perfusion. Question 35. Which developmental milestone should a 4-year-old achieve? A. Riding a bicycle. B. Tying shoelaces. C. Hopping on one foot. D. Using a spoon. Answer: C. Hopping on one foot. Rationale: hopping on one foot is expected at 4 years. Question 36. Which intervention is priority for a child in diabetic ketoacidosis, DKA? A. Insulin bolus. B. Oral fluids. C. IV fluids. D. Sodium bicarbonate. Answer: C. IV fluids. Rationale: fluid resuscitation is the first priority. Question 37. Which sign is expected in a child with rickets? A. Bowed legs. B. Blue sclera. C. Muscle spasticity. D. Jaundice. Answer: A. Bowed legs. Rationale: vitamin D deficiency causes bone deformities. Question 38. A nurse is caring for a child with febrile illness. Which intervention reduces fever safely? A. Ice bath. B. Aspirin. C. Tepid sponge bath. D. Cold packs. Answer: C. Tepid sponge bath. Rationale: tepid bathing helps reduce fever without causing shivering. Question 39. Which assessment finding is expected in a premature infant? A. Increased muscle tone. B. Thin translucent skin. C. Large breast tissue. D. Strong suck reflex. Answer: B. Thin translucent skin. Rationale: premature infants have thin, fragile skin. Question 40. A nurse is caring for a child with pertussis. Which finding is expected? A. High fever. B. Whooping cough. C. Vesicular rash. D. Koplik spots. Answer: B. Whooping cough. Rationale: pertussis causes paroxysmal coughing with whoop. Question 41. Which intervention prevents infection in a child with leukemia? A. Fresh flowers in room. B. Live vaccines. C. Hand hygiene. D. Raw fruits. Answer: C. Hand hygiene. Rationale: hand hygiene is the most effective infection prevention. Question 42. Which sign indicates fluid overload in a child? A. Weight loss. B. decreased BP. C. Crackles in lungs. D. Dry mucous membranes. Answer: C. Crackles in lungs. Rationale: crackles reflect pulmonary congestion. Question 43. A nurse is teaching insulin administration to parents. Which site is best for consistent absorption? A. Thigh. B. Abdomen. C. Buttocks. D. Arm. Answer: B. Abdomen. Rationale: abdomen provides most consistent absorption. Question 44. Which finding suggests child abuse? A. Bruises on shins. B. Burns with glove pattern. C. Fever. D. Scraped knees. Answer: B. Burns with glove pattern. Rationale: patterned injuries are highly suspicious. Question 45. Which lab value is most concerning in a child with vomiting? A. Sodium 140. B. Potassium 2.9. C. Glucose 100. D. Calcium 9.0. Answer: B. Potassium 2.9. Rationale: hypokalemia can cause life-threatening arrhythmias. Question 46. Which condition causes a blue-tinged skin color at birth? A. PDA. B. Tetralogy of Fallot. C. ASD. D. VSD. Answer: B. Tetralogy of Fallot. Rationale: TOF is a cyanotic heart defect. Question 47. Which teaching is appropriate for parents of a child with asthma? A. Avoid all exercise. B. Use rescue inhaler daily. C. Identify triggers. D. Stop meds when better. The answer is C. Identify triggers. Trigger control prevents exacerbations. Question 48. Which sign indicates readiness for toilet training? A. Age 18 months. B. Dry for 2 hours. C. Vocabulary of 10 words. D. Walking independently. The answer is B. Dry for 2 hours. Bladder control is key for toilet training readiness. Question 49. A nurse is caring for a child with Kawasaki disease. Which complication is most concerning? A. Joint pain. B. Coronary artery aneurysm. C. Rash. D. Fever. The answer is B. Coronary artery aneurysm. Kawasaki disease can cause life-threatening coronary complications. Question 50. Which assessment finding is normal in a toddler? A. Fear of strangers. B. Concrete thinking. C. Parallel play. D. Imaginary friends. The answer is C. Parallel play. Toddlers engage in parallel play, not cooperative play. Alright, if you made it this far, respect. You just tackled 50 high-yield pediatric Nclex questions, and that's not light work. Now here's the real question. How many did you get right? Drop your score in the comments. No shame, only growth. If this video challenged you, that's a good sign. That's how Nclex trains your brain. Make sure you like, subscribe, and turn on notifications so you don't miss our next Nclex mastery session. Tougher questions, smarter strategies, and zero shortcuts. This is MCQs Master 101. We don't guess, we pass Nclex. See you in the next one.